Perfect. That works. Thank you.
Sure.
Sorry.
No, I'm sorry. If we could go around the room just so Dr. Pugh is aware who's on the line, and we'll go ahead from the battalion.
Brady Stone from the battalion.
The Eagle.
Megan Rodriguez with the Eagle.
KBTX.
Haley Verostek.
KPRC in Houston.
Yes, Rochelle Turner with KPRC.
WTAW.
Bill Oliver.
Okay, and then we've got our social media team, Krista and Nick. Hello. And there's one more person on an 832 number. Who's that?
That is also someone from KPRC. They are recording this interview for us. So we can show it.
Got it.
So that's someone from KPRC.
Okay, great. Well,
Kelly, I missed the name of the WTAW.
Bill
individual.
Oliver.
Bill Oliver.
Oh, thank you so much.
Bill, you might turn up your sound. You're very hard to hear.
Any better there?
Much better.
All right.
Yes. Okay, well, we will kick this off. The reason I asked Dr. Pugh to make himself available, obviously, is because a lot of you have been asking questions in the last few days with regard to students and the COVID situation on campus and space limitations, things like that. So, you know, we could go around the room here. It's very informal. So we'll go ahead and start with Brady, the student newspaper.
Hi, Dr. Pugh. So yesterday, and actually A&M just confirmed the cases in sorority houses. Will recognized student organizations be penalized in any way for not following any of A&M's COVID-19 health and event planning guidelines?
Okay, can you give me one second? Brady, can you repeat the question one more time? My apologies.
Will recognized student organizations at A&M be penalized in any way for not following A&M's COVID-19 health and event planning guidelines?
There's a potential for that. So as Brady's asking about, we do have student rules and rules for student organizations. And with some of the new guidelines that are out there regarding face coverings and outdoor gatherings. So yeah, Brady, there very well could be, and there can be right now. You know, I'll share with you that a number of organizations were notified today for some infractions or alleged infractions that have transpired. And so we'll continue to move through that. Like anything else with students and orgs, we also do due process and we provide that. But yeah, I think there are some ramifications that are out there as a potential. I think the biggest item right now, Brady, has to do with, you know, the outdoor gatherings, the face covering policies, you know, the social distancing aspects that are there. We want them to be able to engage. We've been trying to create different environments to do that, but the reality is there are some occasions where it's not, and where it doesn't happen. And I'll happily share some other things in there. I don't want to consume all the time, but there's a lot of things that are happening that are going on even tonight that'll begin to help students. How do we help students comply with what the rules are, as opposed to sitting back? And we haven't been sitting back at all, but how do we even get more out front right now is what we're looking at doing. So
Could you tell us what some of those things are? Just what you guys have been doing?
Yeah, so for instance, and some of you may see, especially the local reporters of individuals gathering to play Frisbee and basketball and volleyball and those kind of, and that may not be a formal student group as we have students on campus. So we have individuals from our recreation center that will be out and about on campus today to help set students up into activities and in I guess, framework that they can do that with. So for instance, in our recreation gym, we're following the state guidelines as well. We do 3-on-3, 6 foot apart. And so we're going to be out there teaching, training, trying to help them abide by the rules, abide by the requirements of GA-28, GA-28 amended, GA-29, those executive orders. And I think the assumptions we had: signs, communications, emails, return to campus starting guidebooks, regular communication out to student organizations. But sometimes you got to go back to that old proverb of you got to teach a person to fish and then they can eat for a lifetime. Well, at this point, we're having to be a little more remediated, go out and teach individuals how to fish. how to engage in the outdoor activities. And so that's one area. We've got some street teams going out from health professions as well. You can call them ambassadors if you want, that will be out there working with students, individuals, groups, to help them comply. And it's not a catchy gotcha sort of approach. It really is, how can we help you have an experience that you're trying to have here during a pandemic? And that's really been the approach right now. But there are some that purposefully and wantonly will continue to sort of deviate, and Brady, and those are the ones that we'll respond to. We'll do some interim actions to stop those activities, and then we'll move forward with the formal process as well. So there's some accountabilities that are out there.
Thank you. Megan?
Yes, thank you so much for having us today, sir. Before I get into my question, I just want to make sure that I understood something that you just responded with Brady's question in regards to those enforcement policies and teaching actions that you were just mentioning. First off, am I understanding this correctly? Essentially, if first steps are just going to be trying to teach students how to abide by rules, and then other actions would follow, potentially, if they didn't regard those lessons?
Yeah, I think that's a fair characterization from a progressive discipline standpoint, if you will. Is you want to engage, you want to be a resource to those students, but if the continuations and deviates occur, then you've got to begin to do something a little bit different. So you begin to teach, you remediate, and then you have to redirect in different ways.
Yes, sir. And again, one more follow-up before I get into my main question with that. When you talk about potential other items, I guess, what could those potentially be? What are some of those backup plans if some student organizations were not to be abiding by the regulations down the line?
Sure. Well, and again, if you were to go to a student conduct code, you'd see the available sanctions that are out there. And so you've got a variety of things from, all the way up to and including loss of registration recognition. That's sort of the furthest extreme that one goes to in that thing. But you begin to see, loss of social activities and, restricted access to campus resources. It could impact for some the ability to recruit students in traditional platforms that are there. And again, those are the things that happen on the deviations. And I'll share that. I'm not anticipating a lot, by the way, Megan. What we're seeing is a lot of compliance. I could share with you right now, as we look at the meeting schedule for campus, there are very few meetings scheduled in our meeting room because the students are abiding by what we ask them to do, especially early, and that is do a lot of your meetings on Zoom. Have those conversations in the small groups and the settings, even the recruitment in a remote framework, and we're working with them to do that. So, we will see the deviations that occur, but we're going to see that on a number of different platforms anyway, individual students and groups, but this just happens to be an extension of that.
Yes, sir. Thank you so much for expanding on that. Now, for my main question, I wanted to ask you a little bit about a petition that I've seen going around regarding, I believe it's mainly graduate students who are kind of leading the charge on that petition. Some of the items they talk about include asking for anyone who requests permission to teach online to be permitted to do so, as well as other demands such as hazard pay. Just first, as me trying to understand the university's approach to this, can you break down for me what the university's current protocol is? Have there been a lot of people asking to teach online? Were people denied that possibility?
Megan, my apologies. The Vice Provost for Graduate Studies, Dr. Karen Butler-Purry, is coordinating with them and the students on that particular item. What I can share with you is I did visit yesterday with the Graduate and Professional Student Government's president, and he and I did walk through, if he wanted to see what my thoughts were with some of those areas that are there. So he and I did visit, but from the petitioner standpoint, that's being responded to by the provost and the vice provost side, because what you see there is predominantly employment type issues, which is that role between the TAs and the university, as opposed to the quality of the student life on campus and do graduate students, their activities, their counseling, those kind of pieces that fall under the domain that I have. So I wish I could give you more insight to that, but I mean, it's.
We can get you an answer from.
So Dr. Butler Purdy is the individual who's the best person who's been working with that group. And I don't mean to situate that to her, but she's the one who's been taking the lead on that institutionally.
I'll hook you up with her, Megan.
Great, thank you so much.
Was there another question you might have had for me?
Yes, sir, actually, and this might also kind of fall into another category, so my apologies if that's the case. But I was on campus yesterday and kind of talking to just different professors and students about their thoughts on coming back to school and on campus again. And most people seemed very excited and pretty positive, which was nice to hear. But there were a few students who, when I asked them about the policies that A&M has outlined, one of the concerns they pointed out was the COVID-19 reporting portal. The concern specifically they had was about there being an option to have other people or to report other people who might be might have COVID-19 or things of that nature. I'm not sure if they or I were misunderstanding that situation when I looked onto the website, but if there's anything that you are able to comment on in regards to that policy.
Sure, and happy to do that. So for the folks that are out there, that there has been some social media items out there. There was I think a Fox News story on Friday night that ran, and the reality is there's two different locations where the campus can share concerns that are out there. And so, as you might expect, we had a lot of questions from faculty and from staff early on, with 70,000 students returning. What happens if? What happens if a student doesn't do this, or what happens if a student doesn't do that? And so the primary means by which to do that is through our campus discipline process, the Dean of Student Life office. And there's a community contact reporting portal that's there. So that is one of those areas that provides an opportunity for someone to identify an individual student or group that may not be doing right by the policy. And then we've got investigators that look at those. What I'll share with you is almost completely right now, it's someone who's driven by taking a picture of something, they've sent it in. It's not something that's actionable on those things. And on that same list, that same website, we talk about, you know, please be kind, talk to somebody, remind them. We have always been saying, be patient, you know, approach somebody and say, hey, by the way, you know, could you put your mask on? Or you're within 6 feet, could you both put a mask on? Or could you separate by 6 feet if you're outdoors and you don't have a face covering? So trying to get people to have conversations, to be, and even today I released a video that went out to the campus, and it talks about in there of being respectful, but having a little grace in how one does that. And I think we could all use a little of that in how we interact with our civility these days. So that's one area of that. The other one that was getting a lot of attention is if you were to go to our Texas A&M University website, and so the COVID reporting form, that provides an opportunity. Now, I have never seen any place where we have promoted that to be, as someone called it, a snitch channel, by the way, and I'll probably get in trouble for calling it that, but that's what it was promoted as the other day. We have never said that's where you go to snitch on somebody or turn somebody in. That's always been identified as a self-reporting portal that has that option available. And it may be that I'm reporting myself, but I also need to report somebody else while I'm doing that. It's never been intended, how do you out that? And I do understand in this cancel culture where we're at, where people might see how somebody could abuse it. But that was never created as an intentional place where we want you to turn people in. If you want to turn somebody in for a violation, we want you to go over to the conduct piece, just like you would if there's an assault or a harassment, you see vandalism, those kind of actions, alcohol violations, the same sort of piece. That's where we do that. This is intended to go to the contact tracers to identify people that need to be visited with. And it's not going to be taken out and then turned into a conduct scenario. That is solely the contact tracers with HSC are doing the contacting to see if we need to follow up. And unfortunately, if somebody does decide to use that in the intent that it's not intent, or the purpose is not intended to, a little bit of shame on them, by the way, because it's taken contact tracers away from what they ought to be doing. And there's only limited amounts of time to do that. We're trying to comply with what the governor's asked us to do, what our county needs us to do, and what our campus is relying on us to do. And so that's what I'd share. It's a wonderful piece, but at the end of the day, it was never intended that way. And it's this individual perspectives on how it could be used versus how we've even seen it used. So that's what I would share with you on it. So there's two different platforms, and that's a way around it.
Yes, sir. And just to make sure I understood, so essentially, if somebody were to use that option where you're allowed to report someone else, is that essentially like if you were ill and then you realized, oh no, I have COVID-19, I'm going to report it, and I was also hanging out with these people, so here are their names. Is that essentially what that is?
It could be that as well, but it may be that you know somebody. I mean, and again, I think that one of the biggest hazards we've got available right now is somebody who tests positive, who doesn't go into the portal, or I self-identify that they've done that, because it gives them hours or days or longer where they could still have contact with individuals, and that exposes a greater number of our members of our community. That would be a place where you could do that. Now, our contact tracers are going to reach out, they're going to confirm, but it's not going to be one where they're turning somebody in. That's the medical investigative aspect of this. If you want to turn that person in for a different violation, go to the conduct office. That's the route where that's intended to. That portal is designed to help us mitigate risk, to identify individuals, and to reach out and get them care and assistance. It's not meant to do the other pieces that's being described.
Well, and Megan, I'd just add that anybody who goes through that self-reporting portal, they have to sign in through their UIN. So it's not anonymous. And so, that likely will stop a lot of people seeking mischief.
Thank you both so much.
Sure, we'll come back if you have more questions. Sorry, go ahead, Dr. Pugh.
No, whoever you want to go next, Kelly.
Yeah, Bill?
I am here. First of all, Dr. Pugh, thank you and the other decision makers at A&M for providing us public information, such as the tough release this afternoon regarding having to announce about the two sororities. Appreciate having the public information.
You're most welcome.
The question is essentially, what are the takeaways that those of us who don't have an affiliation with the university but live in Bryan College Station should know from your world? What do you want to share with the community about what you are doing that's going to be a benefit to for us to know about, in addition to all the other reporting that's going to be taking place?
And thanks for the open-ended nature of that, Bill, because I live here too, like you all, and so, and family and kids as well. We've been, the university since March as we got into this. I mean, we've been working tirelessly in preparing to reopen. And what I said, so many of our student leaders have been a critical component to that. And as they look at what they're doing with their clubs, organizations, Greek life in particular, fraternity and sorority life, if we focus on that aspect, they've been starting on their recruitment and process a year ago. And then as we got early into the summer into June, they realized they had to pivot. And so people need to realize the intention was to have a traditional recruitment process. And in July, early July, they shifted that to go virtual. And I'll share with y'all, our students did that, and it was only Monday that the National, or I should say NPC, National Panhellenic Council, announced nationally everybody else is going virtual. And that went into effect on Monday. Well, we've been operating that way and beginning to set the process. So doing all the pieces there to mitigate that. And that's, when you think about the challenge of that, I think that's the big piece. You've got 1,500 young women coming to campus who desire to be part of an organization. They want an engaged campus. and now they're having to interface like they ended their senior year of high school with. And so again, now you've got competing interests. How do we continue to sustain and grow membership? How do we connect with the right people? So they're doing all the things right that they can, and they're also being challenged by the desires and what they really think a university experience is like. So they've been doing outstanding things. So here's what I tell you as well. When we reached out this morning, I had a chance to meet with both of the chapters, their leadership, advisors, House Corporation individuals. They have already been instituting a number of their own actions before we even made the call. They all had their own protocols. So back in July, we were meeting with them as well, going over what their protocols were should it happen in the House. So they were anticipating that these things were going to happen. The idea that we were going to get through the first month without a sorority woman or a fraternity man or a cadet or an athlete without contracting the virus, I mean, that would have been naive. So we've been working with this framework that it's going to happen. So they were already there. So they had already isolated women who had tested positive, who they were aware of, and were beginning to take steps. And so when we reached out this morning with the health department, the guidance with us and working together, they said, you know, how do they get in line quick? I mean, it really has been an easy process today, except for the part it's just been a lot of questions and how do we help steward this? And, you know, we got hundreds of members that we're working with here now to be able to get out. And how do we activate testing for their members that haven't been tested? How do we get them to make sure they get into the portal, they get into the testing protocols, set up schedules, but they're running to it. And you know, I can't tell enough how many times they were saying, thank you for your guidance, thank you for the help. And we were saying the same thing, thank you for your initiating these actions because it saves us some time. So everybody's had plans in place in preparation for the pieces that are there. And I think we're in a good place to what we're talking about, how do we box in the virus right now where we see these things come. And I think the other thing is we're looking at what are we going to learn from these first two that are going to help us on the next two. And those could be in a Greek organization. They could be in another club organization, one of the thousands that we have. It could be in an apartment complex that's out there in our community. So, but we're working hand in hand with those groups, and the partnership we have with the health department's been fantastic with both mayor's offices. I mean, so it's just been a phenomenal piece. I hate to shine it up like that, but we were ready for and anticipated the different things that were happening to be able to put the responses in place. We just had to have, unfortunately, the cases where those were activated.
Okay. Bill? Any?
Well, I have all sorts of follow-ups to that, but I want to give everybody else a shot.
Okay, Haley?
Hi. I don't know if we're able to answer some of these. They're kind of specifics on what we just learned about the sororities. They're all being asked to quarantine. And I mean, is that what happens with anyone who gets the virus? If a faculty member gets COVID, if any student gets COVID, they all go into a 14-day quarantine. So does that mean all of those students will now be going to all online classes? And do we know how many students that is already that will now be quarantining for 14 days?
Yeah, I don't have the specific number for you, but let me answer what I can for you. And I don't think there's anything out there that's a challenge to be able to share with you. So comparing this incident to another incident may not be an equitable piece because what other protocols are in place. And we talked about in the release was individuals that were positive in activities that created exposure. If you walk into a classroom, we've got distancing, we've got masks, we've got other safety protocols, we've got cleaning that are going into effect, screens, masks, a number of things to protect the faculty member, to protect the students, to make sure that we're mitigating that the best we can. So if that faculty member tested positive, the tracers would look at that and say, was there an opportunity for proximity, 15 minutes, no mask, those kind of provisions. In this particular case, they don't have all the information, and so the approach was we need to put I said, box it in. And so looking, how do we do this? So we've got all these members, and then you work from the outside in as opposed to the inside out. But we know that there's a chapter or two chapters, each with some significant numbers of positive. And there was an activity that created opportunity for close proximity within 15 minutes. So you got the opportunity for transmission and no mask, even though indoor and outdoor. So you've got an incident that happened that's connected with it. So that's what I would say is you're looking at not a particular number and not a particular act, but you're looking at the combination of all those. And then we listen to our guidance with Chris Meyer and Dr. Gibbs and Dr. Parker and the experts that are helping guide us to move that. So it's that combination that had to make that happen. So not everything is going to be responding to the same. However, I would tell you, I think we've got a good model here that they look at that we've discussed on what would you do in a residence hall, in a apartment complex, in a barracks, if you will, when you've got potential exposure activity together, that creates a different scenario that's there. Haley, what was that first part of that question? My apologies. I meant to jot it down. I had a pen and all, and I didn't do that.
I don't remember. I think it may just have been how many students is that? Would that be, and what is that quarantine process for them? Does that mean that if they
Sure.
are going to classes in person, they will no longer for 14 days?
Right. Let me do the first one. So our sorority, chapters, our CPC chapters, average about 270 members. I do not know the specific size of each of those houses, how many live in versus how many live out. They just went through recruitment. Quota was right over 80, so they've each got 80 plus new members that are there. Most of those are going to be first year students, and most of those are going to live in the residence halls. So we start working backwards on that as well. So it gives you an idea of the numbers that are there. What the chapter reported to me this morning as well, they have some members who are completely remote, who've never returned to College Station. And as they go into the portal, they'll be able to share that with the tracers, and then maybe the response is different. But what we're being told is from the tracers is 14 days from the last possible exposure date. So if it was Sunday, it will be 2 Sundays forward. We're asking all of those individuals to be tested. We're working on how do we take the tests to them, by the way, as well. We've got enough staff and enough tests available that our student health services is looking, how do we move to their locations to help them? Instead of bringing them onto campus, how do we go to them? Parking is a little easier for them at the house as well. And we're asking them to quarantine. So yes, by the way, every one of our classes that's in person is also being broadcast remotely. And it was designed just for this. So if you went into quarantine, you're going to be able to access and continue to matriculate for 14 days as a result of the remote learning opportunity that's there. So that's already been sort of predetermined and set that we're able to do it. So yeah, we need them to stay out of class for 14 days. If they're living in a house, living in the sorority house, if they're sharing a restroom, they need to wear a mask down the hallway, just like we ask our students to do in our residence halls. Continue to operate safe practices. Don't assume everybody is in there as positive. You're still trying to protect your peer. And so we do need 14 days, safety protocols, continue to distance, wash your hands. If you're interior in public spaces, make sure you're wearing a mask. If you and your roommate in a room, that's a different story. But those are the things that we continue to hammer home, the things we continue to visually display as well. And that's what we're asking them to do. And I know there's going to be lots of questions from them, and we'll continue to work with them. But that's what we have to do at this present time. Get them to quarantine. They need to go into the portal and get them tested. And in the meantime, honor that quarantine, work with the university, work with delivery services for food so we don't have a lot of interaction with the community, so we don't create any opportunities for additional spread outside of what that box is.
Haley, I'm going to put in the chat the website you can go to if you want to read more about the definition of quarantining and all that.
And then am I able to ask just one more question?
Sure, yeah.
Other campuses have, I guess, already gone fully online or shut down campus. I know that y'all have a phased plan to kind of close school if that were to happen. We know that some of these other schools have gone all online after just 200 cases. what does that look like for Texas A&M, that phased closure? And at what point would we go all online? Because we know it's not all or nothing.
Well, and I appreciate you knowing that it's not all or nothing. And I would say we have a phased operation on how we stay open and viable, and we're supporting the needs of the students and providing the opportunity to teach. It's not phased to closing, it's phased to recovery and phased to get through aspects of this. So that to me is what the model is. And so if we need to be able to respond to hotspots in particular areas or concerns that we've got is what we're trying to do. So again, you look at the first month trying to say, honor the governor's no more than 10 in outdoor gatherings, and indoor spaces have required occupancy numbers. All those things go into effect to make sure we're trying to mitigate the best we can. And maybe we get to the first month and we can open up a little bit more, hopefully, as this spikes a little bit and comes back down. I look at, the reality is in the spring, we never closed our residence halls. We stayed open throughout for students that needed help. And up until the point when when we went into a lockdown, we were doing a lot more, and we still had students throughout the semester. We had students in the halls in the summertime. Not many, by the way, but those that need to be here to be successful. That's what we're trying to accomplish here. So I don't look at this as a phase to close. Look at what do we need to do to be able to respond to that. I think Monday, the provost was in an article with Inside Higher Education, and she's our COVID czar, by the way. And she'll tell you that, we may have to shift large classes into remote for a week if we're seeing some spiking. We may have to do some things based on first-year classes or fourth-year classes, or we may have to do something in a rec center or in a residence hall. And if we can begin to do really well at tracing and identifying where the threats and the risks are, then we can respond to those areas without impacting the totality of what's there. So that's the approach. And as we begin to see more and less, but we're still monitoring the metrics that I think that people are talking about, what's the city doing, what's the county measuring, the things we're looking at of the number of, isolation beds we have on campus, how many students are in quarantine or isolation. And I'll share with you, we have 248 isolation beds currently identified that have, a room, their own bathroom, and if we need to isolate an on-campus student, they go in that space, or if we need to quarantine. Presently, we have 16 students who are being quarantined, which means they've had potential for exposure, but they're not. And so isolation is when they've contracted it and you isolate. The quarantine is about the same thing, but it means that they've had exposure. We don't know if they're positive or not. So we've got 16 currently in there. And think about this, so 248 can quickly become 500 if you think about the roommate effect. So if we need to remove one roommate into a quarantine situation, the other roommate's already quarantined. So it's a 2-for-1 model. So while we have 248 identified, the potential's there just using the math of having 496 available at that particular time. So, we've got the provisions to be able to do some of those and to be able to respond as needed.
Going back to that number of 16, if you don't mind, could you clarify when you said that they're in quarantine, that means, give that definition again.
And as you put up there as well, with regards to the link. So quarantine is when you've had exposure and we've not determined yet if you're positive or not. And so you're maybe awaiting a test, but so my roommate tested positive. I'm going to go into quarantine. My roommate's going into isolation. And I'm going to be tested, and then I'll be tested later to see, over a 14-day quarantine period to make sure I'm okay. Or at least when that last exposure was relative to what was there. So that doesn't mean somebody's asymptomatic. It doesn't mean they're symptomatic. It just means we don't know what's there yet. And we're awaiting test results. And if they're negative, we're going to come back and test a period of time later, just at the end of the incubation period to get them through that. And that's what's happening. And by the way, all those students that, we're delivering meals, RAs meals are prepared, we bring them in, knock on the door, they leave, they open the door, take it. We've got provisions on how trash is recovered. We have provisions on how laundry is done for those individuals that are in those spaces. So if you think about having to do that for potentially that number, it sounds daunting, but we've got a robust staff and a great team that have planned out pretty well for it.
That's great. Rochelle?
Yes. Okay, yes. So quick question. So you said you guys have 240 isolation beds on campus or somewhere near the university, correct?
248, yes, ma'am.
248, okay, 248, that's the number I was missing. And right now there are 16 students being quarantined. So that means that they may have tested positive or they're waiting for a test result for the coronavirus.
Correct. We're waiting for the test results through their period of.
Okay. Okay, perfect. And then the 14 students who are linked to the sorority cases, the COVID-19 cases, were these cases reported before or after bid day? And did these students socialize with any other students with the other events that were happening? So if they had like a party, did these students know they had COVID? Were they didn't have any symptoms, or how did you guys find out about these cases?
The students self-reported themselves into our portal. I do not know when they tested positive. I don't have the dates on each of the cases and when they tested positive, when they began to experience those symptoms. What I do know is that some of those who were positive, that we know now that were positive, did have occasion during an event of connecting with individuals within their chapter. And it's that exposure we're not certain about that created the issue. So as we think about the numbers in one house and the exposure, that together said we need to quarantine the group and begin to work our way back in to find out the extensiveness of it. So does that make sense?
Yeah, okay, that makes sense. Okay, and some other questions that I have, like, so school started yesterday, right? Or classes started yesterday for
Yes.
Texas A&M. What is the university going to do to, I know you mentioned that there's several ambassadors and people helping out city, local, state officials, but what are you guys going to do to prevent this in the future? I mean, I did reach out to the city, who says that there were two organizations that got approval, Zeta Phi Alpha and Chi Omega, for the social gatherings, but it seems like the other sororities didn't do what they were supposed to do. So what are you guys going to do to prevent this from happening in the future?
Well, the immediacy thing for them is they're all going on an immediate cessation of activities, by the way, and that information is gone out to them. So they're barred from engaging in those kind of pieces right now, and certainly the chapters that are quarantined have no activity as well. Again, this is where we begin to sort of tighten up on them with regards to what's happening there. Again, that's sort of the piece of how do we continue to engage, and do we have active eyes out there a little bit more, and how do we approach? So we've got, again, those ambassadors that are going out. We've got the teams that are, I apologize, got three things running through my head here with regards to this. So we've got a number of some training mechanisms happening right now where we're going to have like our police being able to approach individuals to talk to them about what they're doing and or what they're not doing. We've got the mask. I don't want to call it a mask patrol because it's not that. It's people out there trying to draw attention and identify that's there. But here's the reality is we've got 60, I want to say the number is going to be 50,000+ students that live in Bryan College Station that are in apartment complexes. They're in individual residences that are being leased to them. We had a dispatch that went out today to the property managers in town, identifying a series of things we're asking them to do. They're the landlord. So just like what we're doing in our residence halls to ensure mask coverage and face covering and social distancing, and we've blocked off groups of areas so there's occupancy limits in different areas. These were groups that were communicating that to their tenants, their students. And we've heard stories of major pool parties, that have occurred where people aren't abiding by what those rules are, and we're reaching out to them and asking them to do the due diligence that they should be doing as community members, as the business members that are renting to our students. And so it is on them. It's on everybody in that process. So we have those conversations occurring as well. Rochelle, I'll tell you, more of our students are doing right than are doing wrong. And I want to say a vast majority of those students, because you can walk around campus and see the number of masks, you can walk around campus and see the distancing and people practicing. And somebody forgets that. I approached a student the other day who was studying already in the flag group. And I walked up and said, hey, I need you to put your mask on. He was so apologetic and said, I'm really sorry about that. I forgot. I sat down, I took a drink, and he put the face mask back, the face covering back on. That's the kind of stuff that we've got to do. We've had very few instances of somebody saying, I'm not going to do it. But again, these are the ones where we still have to deal with, I think as you started in, groups that have differing opinions about where they go. But I also hope that we're effectively communicating both in this release, by my doing this, to other student groups. I hope Brady runs a story on this to say, you know, there but for the grace go we. So if you want to be in quarantine, if you want all your members to be in quarantine over 2 weeks to do this, then go ahead and deviate, because that's what's going to happen. And if you do it on the purposeful way, knowing what we know now, the outcome to your organization is going to be more challenging for you. And so, you know, that's just the reality of what's there on it. We've got to ratchet these things up, and hopefully we learn from this and other groups can learn from this. But the last thing I'd share, if there's a question from a group or an individual about how to do it well, call us. We will work with you. We'll figure out how to accomplish what your mission is, just like we've done with Fish Camp, just like we did with new student conferences over the summer, just like we've done with a number of different programs, Excel, Latino Lagrador, the Ideal program. All these things we've done exceptionally well through distance. We've created engagement. The entirety of Howdy Week we did. We have the ability to do this. These are singular incidents out of 1,100 groups. And I don't want ever to paint it with a broad brush that our students aren't complying and organizations aren't trying to be good, because they are. And this was a failing and a miscalculation, and there's going to be recovery as associated with that. And it's a challenge for their student leadership too. And so we still, through this, we're going to learn how to lead. We're going to teach our students. We're going to help them take this as one of the other educational experiences. And they're going to be doing real life scenarios because they're in it now. And that's going to make them a better leader down the road. And hopefully when they leave here and they're out in the workforce, they're going to be better as a result of it. And that's what the challenge is right now, is to get them to function in these environments. So my apologies, I'm really passionate about this, but this is a unique opportunity for students all across the country. You're talking 20 million students went back to school this fall. 20 million students out there that are on the campus. We just happen to be the largest campus or next to in the nation. But that's happening on the small campuses and the large campuses alike. So we're not unique to it, but we need to work with these students to teach them to lead in these environments, because they're going to be in that framework next year or 4 years thereafter. And we're going to be counting on them to do the right thing in those environments. And rest assured, most of them already are doing that. And I think that's a great message, by the way, Bill. Most of our students are doing the right thing. Do we always do the right thing? I don't think all of us do it, by the way. But it really is an opportunity for us to use this as not only a safety piece, but a learning opportunity for them in the future.
Okay, thank you so much for that. And I think my last question is, could you guys explain why these organizations did not, apply for the approval from the mayor of 10 or more gatherings? Was it because they were just so excited, or what was their reason for not doing what they were supposed to do?
I don't have an answer for you on that one right now. What I'd say is that will come out in our investigative process as we go deeper, because we will deal with these things as a conduct piece out of student organization, and we'll find out what their thinking was behind it and why that didn't comply. And so, the irony is, we had two. One of them happened on Sunday. The other was scheduled to be Monday, and that was canceled, by the way. So The one Zeta had scheduled on Monday that the mayor approved didn't happen anyway because nationally they all went virtual.
Brady, I think you had another question.
So I have a couple follow-up questions. Earlier you answered a question about the students who were exposed to COVID-19 in the sororities. Then you mentioned Sunday. Can you confirm if this was bid day? Because bid day happened on Sunday, August 16th.
Yeah, they were, my understanding is they're bid day related events, Brady.
All right. And can the situation in Kappa Kappa Gamma and Delta 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 be defined as a cluster of cases?
I would not define them as a, Kelly, did you say?
Well, I was going to say you're not an epidemiologist. But.
I'm not. That you could ask, Dr. Gibbs or others, but all I would say is we looked at numbers and activities, and it's that blending for us of the exposure that's there that created the dynamic we're dealing with today. It wasn't a preset number. It wasn't a preset activity. It was a combination of those together and the potential spread, and that required the action.
All right. And
Can you give a number of, sorry.
That one I do not know on what would qualify within the eyes of the epidemiologists and the pandemic experts as to what would be a number. And even if you gave you a number, I would tell you, if you said 5, but you're in a residence hall of 500, that's different than 5 in the club of 25. So it all has to be put into a contextual scenario of the number that are there. And I think we've seen that as we've learned over the last 5 months with numbers, is you have to have context with the numbers. And if you don't do that, then you can be led down it's like statistics, as we talk about, you need to know what the context is of the scenario. And again, this is numbers and activity making a decision that's there.
I don't mean to push, but a cluster is defined as about 5 cases with community spread or like person-to-person transmission. Can you comment on whether or not there's more than 5 cases with person-to-person transmission?
I'm not aware of how the transmission occurred, by the way.
All right.
And I'm not aware, by the way, I couldn't tell you if transmissions happened, by the way, as a result of the activity. That's what they're trying to figure out.
All right.
Okay.
I don't mean to be elusive with it. It's just.
Go ahead, Dr. Pugh.
It's just, I can't tell you that's what the contact tracers are trying to determine.
Right.
All right, thank you. And my last question, the collegiate Panhellenic president told the battalion that there were also cases in Kappa Alpha Theta and Delta Gamma. Can you confirm whether or not these sororities have reached out to the university?
I can confirm for you that the university's reached out to several chapters, by the way, who have identified some numbers that are there that didn't rise to what we're talking about. And we're working with those chapters to get all their members to go through the contact tracing process immediately, so that the tracers can identify, do we need to do something more intentional?
All right, thank you very much.
Mm-hmm.
One thing that I think we can't emphasize enough is, Dr. Pugh, you work with a lot of young people. How do you get through to that population? They might not have known somebody that has had COVID. They don't know the seriousness of it. They don't know anybody who's died of it. How do you get through to that mindset?
Kelly, thank you. It's an interesting dynamic that's there. So I would tell you the same thing what we do in a number of things. That if you think pedagogically, how many times do you have to tell somebody before they hear it? And the answer is one more than necessary. We cannot let up our communication with our students, with their families, with our faculty, with our staff, that we are in the middle of a pandemic and that we are trying to engage while accomplishing our university mission of teaching and research. And so we have to continue to do that. Again, that message I sent out today was recorded last week. It wasn't like I did it this morning in anticipation of this. We'll have more going out next week. We'll have more going out the week after. We will continue to beat that drum until it finally takes root. The counseling professions say one more than necessary. How many times do you see it? You see it one more than necessary. The same thing with your kids, but at least there's multiple. And I'll go back. Brady had to take, as a student, like all students, faculty and staff, we all had to go through required training. We all had to sign off on a certification as well with the university and the system that said we will abide by these rules. And we have to continue to remind people of what those rules are. And I can tell you, when every cadet checked in during FOW, they were asked those rules again. And some people said, well, yeah, I was with so-and-so 3 days ago, and it was like, we'll see you later. 14 minus 3, you can come back in 11 days. That's your quarantine period. Go get tested. We're going to need to see that. That's the kind of dynamic we've got to continue to have at this. It's faculty members saying something at the start of every class. It's the reminders when you're walking around campus with the sandwich boards. It is in every way, shape, or form of what we do that's here. It's walking into the local grocery store and seeing the mask required and abiding by that, and washing your hands and wiping down your cart. It's going to a restaurant and wearing your mask into the restaurant, sitting down, ordering, taking it off when you're eating. Those are all things. So it's not the university's engaged, but the community has been tremendously helpful as well. So we're all in this together, to borrow the High School Musical phrase, if you will. But that's what we've got to continue to do, and we can't let our guard down out there. And the reality is, and we know, Brady, the majority of this age population, the traditional college age population that contracts the virus, are not at risk. It's the others that we're around, and those that are going to be far more having other conditions that are going to be challenged. And I think that's why you put up on here, 25% of our students are completely remote. I think many of those are still living in town, by the way, due to traffic. But we were encouraging faculty, staff, don't do that. If you've got some condition, let us know. Let's put you in a place where you can be successful without missing a semester or having to do something different. And everybody that's come forward in those scenarios we work with. So to a T, and we continue to do that.
Okay, well, we have taken up a lot of your time. I did promise to go back to Bill, so make it purposeful, Bill. No pressure.
Never any pressure. Dr. P, you made a reference to the university contacting apartment managers to do what they can. What other populations that the university doesn't have control over has the university contacted to also assist in the information effort and potential enforcement effort?
Well, so Chad Wooten, who works out of with the university, who's our external affairs individual, has been working with a number of entities, with the cities, with the mayors, with their legal counsel, working with the police agencies together to see where we can collaborate further. And so Chad sort of point on those pieces that are out there. I would share with you, I think we've got some additional challenges out there. We've got to begin to work with some of our proprietors that might stand on both sides of the aisle with regards to restaurateur versus bar owner. And what's the letter of the law and what's the spirit of the law that's out there with regards to when we operate and how we operate. And I think, if I'm not mistaken, that 51% of your sales receipt needs to be in the restaurant side, right? Food. Well, if you generate that in the first half of the day, you can still work at night. I'm not sure that those places that close their kitchen should be remaining open as a bar at night. I think that creates those environments that are there. But at the same time, I realize they're business owners, they're proprietors, their livelihoods at stake. But so how do we do some things that are safer and make sure that they're still operating within social distancing? And just because you might have a sweet tea or a beer in your hand at 9 o'clock at night doesn't mean you shouldn't have your mask on. It can go up and down. And so individuals need to understand that their long-term success as well is going to be dependent upon their partnering with us in this and our partnering with them. And so they are definitely not in this struggle, if you will, by themselves, but we want to partner. And I think we got some opportunities in that area, Bill, to be able to make that happen and how to extend those conversations. But the city's aware of that as well. And I think we're starting to have some great conversations with with both mayors and both their chiefs of staff. And we've had great conversations now. How do we begin to move into different dynamics as well, where we're starting to see, and this is part of that phasing as well, that I think Haley asked about, is we're seeing this phase. How do we move into this area to deal with it so that we don't have to go lock down or shut down or close entities? How do we fix those things? We've seen it successfully in gyms and other areas. Well, maybe we need to think about some of those other spaces as well, knowing that, again, those people are citizens, they're business owners, they're taxpayers to the area. We want them to be able to thrive, but we also want them to be able to succeed long term.
So other than business owners and other than government officials, what would be your message to the community at large? What should community members receive as a takeaway from your position?
Let me tell you one of those messages or multiple.
As much as you want. That's why it's an open-ended question.
Yeah. One is that, we are working tirelessly around the clock, by the way, as we move through this now into reopening of the fall semester. What I'd say is we need your help. We need you to work with our students that are there. If you live next to them in a neighborhood, get to know them safely. Let them get to know you. If there are concerns you have, how do you approach those individuals? And how do you do it safely and befriend them like you would any neighbor that are out there? When we're out and about in grocery stores, stop and say hello to people too. Just because you have a mask on, you can't see a smile, be nice. But I generally think most of the things are happening. I'd call on our spiritual leaders that are out there in the communities as well, as they're holding services on Saturday or Sunday and Wednesday night. Talk with your congregations and those sitting in your pews and those coming to Shabbat about what's at stake here, and connect them with our students and make those connections as appropriate and safely, because we truly are moving in this together, and we're going to succeed or we're going to fail as a collective. And anybody that would say, well, it was the students, is wrong, because we're out there with them. We have an opportunity to engage with them, to be part of that. We also have to check some of our own behaviors as well and what we're doing. And it felt a lot easier when they were gone. I think it's going to be a little tougher now that they're here with some of the things we were doing. But I think we have a possibility to really set the standard of what's there. But if you have new ideas, you have areas that you want to talk with us about, you can always call the university. We've got the other portals that are out there, but give the Dean of Student Life a call, and give myself a call if you see some things that are out there. Say, hey, I got an idea. Has the university thought about this? Has the university thought about that? These solution finders with us, because that's what we're trying to do every day. We're waking up trying to identify what's out there and how do we solve those issues, and how do we do it for a long term instead of day. And if we can do that, we're going to be much better off.
Thank you.
Yeah.
Okay, I think that's it. I know you've got a lot more to do before you go to bed at midnight tonight. So thank you, Dr. Pugh. And thank you all. If it's on the chat, we'll email this recording out after this. Thank you, Dr. Pugh.
Thank you all.